Welcome to the 6th edition of the Canna-Science Digest, where we'll be going over autism, arthritic joint pain, and the stress of car travel for dogs. You can see all these linked to in my newsletter, Cannabinoids and the People, sponsored by CVResearch, the makers of Plus CBD. And on the cannabinoids, ask me anything. First, this study from Australia in children with autism, giving them very low THC, high CBD oil extracts, and this is the first study of its kind that looked at both subjective and objective measurements of how the treatment worked. The doses they gave these kids started at 5 milligrams per kilogram per day, and since their average age was 13 and the usual weight is 100 pounds for a kid of that age, that means they were getting about 72 milligrams of CBD per day, and then it would be increased weekly if the kid wanted and their caregivers wanted, up to 20 milligrams per kilogram per day, which is about 288 milligrams of CBD per day. After 4 weeks of treatment, 93% of the children experienced significant improvements in their behavioral outcomes. According to surveys of their caregivers, almost half of them saw improvements to their targeted behavioral problems. Also, more than half of the kids reported reduced anxiety symptoms, though it should be noted that about a third of them saw increased anxiety symptoms, which can happen. For side effects, after analysis by an array of tests, there were no side effects that interfered with the general functioning of the patient. The most common side effect was GI symptoms, which did occur in about a third of the patients. That's the most common thing you'll see from high doses of CBD, but most of those reduced over the course of the trial. Overall, these were quite positive results, and you can see more about the data on cannabinoids and autism at CVResearch.info, where I collected all of the important studies. Next up is this data that was recently presented at a conference, and it was a survey that included over 400 patients with different types of arthritic pain, including and especially osteoarthritis and rheumatoid arthritis. Their participants using CBD reported high rates of symptomatic relief, especially in the domains of pain intensity, physical functioning, and sleep. In addition, and this is the big one, many reported CBD allowing them to reduce or completely cease pharmacological treatments, including opioids, acetaminophen, and other anti-inflammatories. Unfortunately, authors didn't collect data on the types of CBD being used, but overall you have a large swath of people reporting that CBD to help with their arthritic joint pain. If you want to see more about that, I have a big page of research at CVResearch.info under musculoskeletal and exercise. And lastly, often one of the most stressful things in the life of a dog, traveling in a car. If you ask vets for pharmacological treatments for this, they will often give trazodone or Prozac or the tricyclic antidepressant clomipramine, but these have a range of negative side effects, including vomiting, sedation, sleepiness, loss of appetite, seizures, and depression. But in this blinded study, where the researchers didn't know which dogs were getting the active ingredient, they were giving them CBD distillate at 4 milligrams per kilogram over a period of 6 months. And this improved their measures of stress during car travel, including their cortisol levels, their whining and licking of lips, as well as independent assessments of behavior. Overall, the researchers suggested that CBD has an anxiolytic or anxiety-lowering effect on dogs when traveling in a car. Also, if you want CBD for dogs, I recommend our peanut butter flavor because, as I've said before, this is wonderful for humans too. 2 sprays for me, 1 spray for Fido. Everybody's happy. Everybody's less stressed.